Hello everyone, my name is Christine Mitalang and I'm from BSNC of Our Lady of Mount Carmel, and today I'm going to do a return demonstration on a proper way of doing immediate newborn care. Okay, so of course the first thing we're gonna do is to make sure that we prepare the room, a conducive place for a mother for the labor and delivery. So our room should only be at least 25 to 28 degrees Celsius. Okay, so we can also check for air draft. When we say air draft, of course, we don't want to have some air coming from outside, okay, coming into the inside while the mother is having a delivery. So what we can do is to get at least a piece of tissue paper, have it drop, okay, and then our main goal is to have that piece of tissue paper drop directly to the floor, which means there's no air draft. But if, say for example, it sways as it goes down to the floor, then you have to locate for the air coming from the outside. Okay, so you close the door, we close the window, close the curtain, make sure that the air is within that room temperature. Okay, after that, we make sure that we prepare all of the materials that we need. So of course, we'll be needing cloth that we're gonna be using to wipe the baby later on, the blanket, the bonnet of the baby. We will also be needing, of course, things to use for, of course, proper cord care, like the Kelly clamp, umbilical scissor, the plastic clamp. We will also be needing later on for anthropometric measurement, like the tape measure. We'll also be needing, of course, rectal thermometer, vitamin K injection, creeds prophylaxis, identification card is very important as well. Of course, we're gonna be needing cotton balls to clean the site, 70% isopropyl alcohol. Of course, dress for the baby, the blanket or the blanket or for the baby, a weighing scale. We'll also be needing this stethoscope, and for us, we will be needing, of course, a face mask, a head cap, and at the same time 2 pairs of surgical gloves. Okay, after we have all the procedures ready, then we also make sure that we check all the resuscitation equipment ready, okay, on the delivery room. So after which, of course, the nursing diagnosis is risk for body temperature alteration related to inability to shiver, inability to shiver, change in environment, intrauterine to uterine, intrauterine to extrauterine, limited amount of insulation. And then, of course, our main goal here is to make sure that the infant will be free from any complication precipitated from hypothermia and cold all throughout the hospitalization stay. Okay, so after which, of course, the first thing that we are going to do is to put on our mask, face mask, put on our head cap, and then after that, we are going to wash our hands with, of course, water and soap. Okay, so of course, let me do a hand washing. So it's, for example, so I already have my my hands washed. After that, we are going to do double gloving. Okay, so let's just pretend that this is a surgical glove. So this is the first pair of the glove. This is the second pair of the glove. All right, so there we go. So after that, of course, we are going to help the mother with the delivery. Okay, so we already have the baby here. So after we have the baby with us, of course, we are going to dry the baby thoroughly for 30 seconds. Okay? While checking or while we are while we are drying the baby, we will also be going to check the quality of the breathing. Okay, by checking if there's any blockage on the nose or on the mouth. There's no need for us to basically do suctioning, not unless if there is some blockage on the nose or on the mouth. Okay, we of course first clean the eyes, the face, the head of the baby, the front, the back, the arms, the legs. Okay, but make sure not to wipe the vernix caseosa, as this will serve as a natural cover for the baby. Okay, and then of course after that, we are going to of course remove the wet cloth, just drop it on the floor. Okay, so let's do it. So wipe the baby. For like 30 seconds. Wipe the baby thoroughly. Okay, while we check the quality of breathing. And then we drop this on the floor. So after that, we are going to put the baby or position the baby prone to the mother's chest, like this. Okay? And then we are going to cover the baby with a blanket and put the bonnet on. There you go. Now after that, after 1 to 3 minutes, we will do the proper cord clamping. Okay, but of course the first thing we're gonna do is to remove the first layer of our gloves. Okay, so after pulsation, or after the umbilical pulsation has stopped, okay, what we are going to do is basically to clamp the umbilical cord 2 centimeters from the base of the baby. And then make sure not to milk the umbilical cord. After that, we are going to clamp the umbilical cord 5 centimeters from the base using a Kelly clamp. And then after which, we are going to cut it using an umbilical scissor. So after we're done with proper cord clamping, let's leave the baby on a skin-to-skin contact with the mother. We just have to observe for any feeding cues like licking, okay, tonguing, or and then we also point that out to the mother to observe any feeding cues, and ask her or to encourage her to nudge down. Okay, so after that, after 90 minutes, okay, what we are going to do is to get the baby from the mother and put her on the table, on the working table. Okay, but of course, before that, we put on the identification card or identification tag of the baby. So after that, of course, we are going to take the baby, put her on the working table. Baby. Okay, so of course the first thing we're gonna do is to weigh the baby. Okay, so let's weigh the baby. Okay, after weighing the baby, we also check for the APGAR scoring. So when we see APGAR scoring, of course, we are going to check for the A for appearance, P for pulse, G for grimace, A for activity, and R for respiration. After we've checked on the APGAR scoring, we now check the anthropometric measurement. So of course, in checking the anthropometric measurement, we are going to first check the head circumference using centimeter. Using, of course, the widest part of the baby's head, just above the eyebrows. So normal should be at least within 34 to 35 centimeter. After that, we are also going to check the chest circumference of the baby. Have it noted. Chest circumference should be at least 32 to 33 centimeter. And then after that, we are going to check the mid-arm circumference. This is basically for us to check if there is an acute, if the baby's malnourished or acutely malnourished. And after that, we are going to, of course, check the height up to the heel. Okay, head up to the heel. And normally, the baby's height should be at least 46 to 50 centimeter. Okay, and then after that, we are going to check the baby's temperature. Okay, and we have to get it from the rectal. So one of the reason why it should be on the rectum is because this is the closest to the core temperature, and at the same time for us to check if the baby is suffering from any anal imperforation, or if the baby has an perforated anal. Okay, so already have the temperature here. Then after that, we are going to inject vitamin K to the baby's vastus lateralis, intramuscular. Okay, so after that, we are going to put on some CRIDS prophylaxis. Of course, CRIDS prophylaxis for us to avoid ophthalmia neonatorum of the baby, or we can say this is the conjunctivitis for infant, which the infant can basically get if the mother is suffering from STD. Okay, and the vitamin K is also being used to avoid hemorrhagic disease of the newborn, since of course blood clotting feature of the baby is not yet that activated during newborn. So let's not put on. It's from inner to outer canthus, just below the eyelids. Okay, so after that, we are now going to dress the baby. Okay, dress the baby. Make sure that when you put on the diaper, okay, do not cover the umbilical stump. So let's just pretend that I'm using the right. Okay, so after that, we cover the baby with a blanket. After we've covered the baby with a blanket, of course, we are going to check the heart rate of the baby. Okay, Normal heart rate should be at least 120 to 160. And then after checking the heart rate, we are going to check the respiratory rate. So respiratory rate of the baby should be at least 30 to 60 breaths per minute. Okay? So after that, after we've taken those vital signs, then we are now going to take the baby, okay, to the mother. And of course, we are going to have her latch the the mother's breast. Okay? Oh, mommy. Baby ko. Okay. So after we're done, of course, the next thing we're gonna do is to document everything that we've gotten, like Apgar scoring, anthropometric measurement, the medications that we've given, like the vitamin K, and of course the craze prophylaxis. And at the same time, we are also going to, of course, get the footprint of the baby. Okay, so by the way, those are the things that we are going to do for a newborn immediate care. So thank you so much for watching, and I hope that you've learned something today. Thank you, and you all have a great day. Bye!